Hey there, welcome to my channel Dentistry with Kashyap. Let's talk about a very interesting topic, periodontitis. It is a serious gum infection that damages the soft tissues, and if it is untreated, it can destroy the bone supporting the teeth, and it is basically an advanced condition developed from untreated gingivitis. Okay, one must know the difference between healthy gums and bones and periodontitis, means diseased gums. Also, you must know the difference between gingivitis and periodontitis. Gingivitis is basically the mild condition, very early gum disease, like there might be bleeding on probing and brushing, but there is no bone loss. Periodontitis is a severe gum disease where there is a bone loss radiographically and tooth mobility, you can feel it. And there are very basic and common differences between these two. What are the clinical risk factors of such condition? Like it could be due to poor oral hygiene, smoking, tobacco, diabetes, genetic predisposition, and abnormal changes like hormonal changes. Also, certain medications you are taking and also weaken immune system of the patient. What are the stages of periodontitis? You may have healthy gums like no sign and symptoms, no bleeding, no mobility. There might be a stage of gingivitis where there is only bleeding. Then there will be a little progression towards periodontitis, like a subgingival calculus build up and the pocket is built up. But if the pocket is deepened and there is aggressive supporting tissue loss, then that is advanced periodontitis. What are the clinical symptoms? Of course, you can appreciate here. There is bleeding on probing. Okay. In 2, you can see there is a pocket detection by CPIT and probe. In 3, you can appreciate the gingival recession, like the root is exposed. In mobile tooth, like you can appreciate the horizontal tooth movement, like mobility. Also, you will see that the tooth is elongated, but basically this is not elongation, but the bone is lost, gingival tissue is receded, and the tooth is exposed, so that seems like elongated tooth. What are the radiographic features of periodontitis? We know there is a generalized horizontal bone loss. In advanced cases, we go for vertical bone loss. We also call it angular bone loss radiographically. Loss of lamina dura you can see, and percussion involvement you can see, and it is the features of a multi-rooted tooth. Widened pedial space you can appreciate, increased pedial space like blackish area. One must know the normal features of normal radiographic features of tooth and its surrounding structure, so you will appreciate the pathological features. Okay, what is treatment and prevention, which everybody wants to know? The first category, if we talk about, this is a non-surgical therapy, of course, scaling, root planing, and you can say the calculus and debris are removed. Category 2, you can see this is a home care optimization, means your OHI, we can say oral health index, yeah, you can say oral health instruction, hygiene instructions. Of course, brushing, flossing, and antiseptic mouthwashes. And adjunct therapy, you are going for antibiotics that may be local, systemic, and targeting deep bacteria, because until and unless you cannot remove the deep bacteria, the condition will relapse, and it will promote good healing if you remove the cause. Okay, category 4, you can go for surgical therapy. Yes, of course, bone grafting and soft tissue grafting. One must know the advanced gum disease and its treatment. Laser. Yeah, the most interesting one is the laser. Like you have lost your anatomy, gum recession, gingivectomy. For such procedures, you are going for a laser treatment. And in panel 2, you can appreciate that there is a socket and they are targeting these bacteria. So what is the purpose of this laser treatment? It could also kill the pathogens and as well as promote healing there. You can appreciate in third panel there is a bone graft which is in powder form. You can put in socket and it will regenerate your own bone cells, like they will induce the bone growth. And in fourth panel, you can appreciate the grafting procedure like GTR, GBR, and this is the most preferred technique. You must know the following conditions like CPIT encoding, bone loss, tooth mobility, bleeding in neck, scale, and percussion involvement. Here we will discuss very important things like CPIT encoding. Like in code 0, there is a healthy gums, there is no treatment need. In code 1, you can appreciate gingivitis, like of course bleeding on probing, and you can say 3.5 to 5.5 mm is a pocket depth, which is normal. In 2, there might be deep pocket, there might be calculus deposition. So in this case, you are going for OHI and scaling, means oral hygiene instructions. In this type of patient, there will be subgingival calculus, a pocket will be a bit deepened. You will go for this patient treatment need like OHI, scaling, and root planning for this patient. But in advanced cases like code 3 and 4, you are going for OHI index, like OHI instructions, scaling, root planning, as well as advanced surgery procedures like flap and bone grafts. One must know how to measure the bone loss percentage. You can say like how you are going to measure it. Full root length you are going to measure from this cusp to this root tip, and then amount of bone loss from tip to this area where there is a limit of bone. So this is the formula how you're gonna calculate this. Bone loss percentage is equal to amount of bone loss, जितना यहाँ पे loss हुआ है, divided by full root length, जितना ये आएगा. और this thing you are going to measure with the CPITN probe of course and multiply with 100, so you will get percentage. So how you will categorize them in 4 stages, like in stage 1, less than 15% is indication of stage 1, 15 to 33% is stage 2, greater than 33% of root is what? It is a severe bone loss in stage 3. These percentages might be asking in any multiple choice question, so you have to learn this very clearly. Okay, greater than, in stage 3 there will be bone loss plus root loss, and in this condition, very severe bone loss, you will see that greater than 33% there will be bone loss but also tooth loss. Like tooth will be too mobile, it might be lost from the socket. Okay, I have added some of the MCQs. Could you please pause or screenshot it and answer me in the comments the following MCQs. First question is that which clinical finding differentiate the periodontitis from gingivitis? Option A, gingival redness, bleeding on probing, clinical attachment loss, and gingival swelling. Question number 2 is, in periodontitis, bone loss occur mainly due to trauma from brushing, host inflammatory smotional plaque bacteria, vitamin deficiency alone, or might be tooth eruption. In next question I ask, what is the gold standard instrument for periodontal examination? Is it a spoon excavator? Is it a periodontal probe? It is a chisel, or it is a burnisher? Next question I would ask, which patient is at greatest risk of progression of periodontitis? Like healthy non-smoker with a good oral hygiene, controlled diabetic patient, heavy smoker with poor plaque control, and patient with fluorosis. Next question is, a patient has 5 mm pocket and horizontal bone loss affecting less than 15% of root length, and the most likely stage is stage 1, 3, 4 gingivitis. What would you suggest this? And I already teach these things earlier. Patient has deep pocket around 1 molar with an overhanging restoration. The most likely local contribution factor is it genetics, diabetes, plaque retentive restoration, or hormonal changes? Which clinical parameter is the best indicator of previous periodontal destruction? Is it a plaque index? Is it a gingival color? It is a clinical attachment loss? Is a bleeding on probing? Okay guys, thank you so much for watching. Answer the following MCQs in the comments and I will tell you the correct answer, and keep learning smartly and patiently.